So welcome everyone to the 25 by 5 Symposium to Reduce Documentation Burden on the US. And my name is Kenrick Cato. I am a steering committee member for this symposium series. I'm also going to be a co-chair of this session. And for those of you that have not been participating in our previous sessions, um, I'd like to introduce our the co-chairs of the entire symposium, which are Dr. Sarah Rossetti and Dr. Trent Rosenblum. And you can also see the other members of our steering committee. And so 25 by 5 is a symposium where our goal is to reduce documentation burden by 75% in the next 5 years. So that would be by 2025. What you see here on the screen is a screenshot of our website. And on the bottom left is the actual URL. I encourage you to visit our website. On the website, we will have information, updated information about our symposium series. We're also placing our videos and videos of the presentations and the presentations themselves, and the chat on the website, and also any relevant information. And so just some principles of our engagement. So we are here to talk about leveraging technology and the existing inputs to reduce documentation burden. And so you can see some of the other core principles that here on the screen. And so to give you a sense of how this symposium series is structured, it's a symposium series with 6 sessions. As you can see, we are in session 3. We've gone through 2 sessions already. I encourage you to continue to attend the other 3 sessions. And so today we will talk about exemplars and key successes. And so before we go into this session, there are a number of housekeeping items that I'd like to talk about. So for those of you who are Twitter, if you have a Twitter handle, please change your screen name right now to your Twitter handle. That'll make it easier for the individuals that are tweeting. Also, we are using the chat. People have been using the chat well to have side conversations. And also, I ask you to pose any questions that you might have of me or Karthik or the panelists in the chat, so that we can have those in the Q&A. And we will be chatting in real time. When you do chat in real time, please use the hashtag 25 by 5. And also, it's important for us to point out that we encourage people to post in the chat and to remind everyone that all ideas are worth contributing. And so I just briefly wanted to go through, for those of you that haven't been able to attend the previous sessions. So in session 1, just a quick synopsis. During our first session, we had 2 amazing panels that focused on what the documentation problem is currently. And so in the first panel, we discussed documentation policy and reimbursement issues. Dr. Andy Gettinger presented on an overview of the Office of the National Coordinator for Health Information and their Cures Act and relevant issues, including efforts to reduce clinical documentation burden. Also talked about the new information blocking exceptions and approaches to enhancing interoperability. Dr. Mary Green from the Centers of Medicare and Medicaid Services provided the work that she is overseeing to tackle documentation burden and presented the tools that CMS has at their disposal. And finally, Dr. Brent James presented his perspectives on quality measurement of burden and did a great job talking about what he sees as most important things to think about when trying to reduce documentation burden and still maintain safe and quality care. And then in our next panel, Dr. Sharon Kirby started with her perspective of documentation for nurses at the Mayo Clinic. She spoke about nursing medication reconciliation and also suggested future innovations that would reduce documentation burden. Dr. Sherry Hess described the cognitive burden of nurses' documentation, going into detail about the volumes of fields and the typical nursing workflow. And finally, I wrapped up the session talking about documentation burden from a diversity, equity, and inclusion perspective. And then last week, we talked about the how of documentation. So in panel one, Dr. Hettinger talked about his work investigating the usability issues related to documenting in the EHR. Dr. Erntel gave a great talk about clinical workflow and the lack of integration of documentation in the workflow. And Dr. McBride presented issues around forms-based structure and documentation. One issue that came up during the Q&A session was the burden that prior authorization process places on clinicians. Dr. Nguyen will talk about the work that HL7 is doing on prior authorizations today. And then the final panel last week was very engaging. Dr. Smith talked about the University of Colorado's use of scribes and teamlets to reduce documentation burden. Dr. Kuma Crystal presented on the state of the science of voice recognition and how voice-driven approaches can be used. And finally, Dr. Pizanzo was the last panelist last week. She closed out with a topic that blew up the chat window: the cons and pros of cut and paste functionality when documenting. So I'd like to remind everyone that the presentations from the previous sessions and the videos and the chats are on the website. And so I will pass it over to my other co-chair, Dr. Karthik.
Thanks, Kendrick. Today's session is going to be focused on highlights, exemplars, and key successes, and we'll be hearing from some extraordinary individuals and the impact they're making on reducing documentation burden. Should we get to the next slide? As Kendrick mentioned before, both Kenrick Cato and myself are today's session leaders. My name is Karthik Natarajan, faculty here at DBMI at Columbia with Kendrick. Can we go to the next slide? So just kind of quickly, today's session, we'll have two panels. The first one will focus more at a national perspective of efforts being done to reduce documentation burden. And the second panel, with a 10-minute discussion in between these panels, the second panel will focus on local, more specific efforts around documentation burden in ways that they've kind of uniquely tried to reduce that problem. And then we'll close off with a Q&A for panel 2, and then the wrap-up session. So I wanted to introduce the panelists. So in panel 1, we have Dr. N.T. Chung, who's the Chief Medical Information Officer in Hong Kong's Hospital Authority, and he'll be providing Hong Kong's perspective of documentation burden. Next, we'll have Dr. Natasha Phillips, the Chief Nursing Information Officer at UK's National Health Services, and she'll talk about lessons learned from the UK and provide an outside perspective of our aim on documentation reduction. Next will be Dr. Vet Nguyen, who will describe an exciting project through HL7 called Da Vinci. And ending that panel will be Dr. Dan Robert. He's the Vice President of Care Delivery and Performance at HCA Healthcare, where he'll describe HCA Healthcare's evidence-based documentation reduction project across their 184 hospitals across the country. And going to the second panel, we have Dr. Bonnie Adrian. She's the research nurse scientist, clinical informatics individual at the University of Colorado Health, and she'll summarize Project Joy, a nursing documentation reduction project, and the key lessons learned there. Then we'll have Dr. Adam Wright, where he'll present on the ClickBusters project, which successfully engaged clinical users to help improve EHR usability. Next will be Dr. Subha Eranjave, CEO and founder of Caroline.ai, where she'll discuss her company's care collaboration tool and provide their approach to clinical documentation. And finally, we'll have Ms. Helen Palomino, Chief Executive of the Cancer Resource Center of the Desert, and she'll discuss approaches to DEI from a cancer survivorship planning perspective. With that, Eugene Lucas will be moderating the chat, and I'll hand it off to Dr. N.T. Chung. And I wanted to thank him especially for presenting, considering it's 2 a.m. in Hong Kong. So thank you.